So, in the early months of COVID, when we knew little about what to expect with COVID-19, so many of us were wondering if the cough or the illness we were experiencing was COVID. So, in April of 2020, Emory Healthcare partnered with Vital software to develop an online COVID-19 symptom checker called C19 Check. They were able to quickly launch this and get it out to the public. It was freely available. And our Health Services Research Center in the Emory School of Medicine analyzed some of the data from this application, as well as local data on daily incident COVID-19 cases and hospitalizations in Georgia over the same time period. And our health services research team developed statistical models to see if we could actually predict cases and hospitalizations using these data. So in the time period we studied in early 2020, thousands of Georgians used the tool, and we found that our model that included data from the symptom checker was more useful in predicting hospitalizations compared to a model that just included this publicly available data from the Georgia Department of Public Health. So we really concluded from this research study that the use of self-triage tools like C19 Check can help systems to predict cases and hospitalizations of COVID-19. And I think that the tool might be really particularly helpful when in a situation in a pandemic when lab tests might be limited or contact tracing might be challenging due to limited staffing. And I think the high use of a symptom checker by the public also demonstrated the demand by the public in really using a tool like this. So, I think this is a good example of health services research in action, where we apply rigorous research methods to help solve a problem that's facing both health systems and the population.
Hello, this is Dr. Justin Schrager, and I'm an emergency physician and assistant professor at Emory University School of Medicine in Atlanta, Georgia. C19check.com was developed at the very beginning of the pandemic in February and March of 2020, when healthcare information was very limited, healthcare access was even more limited, and emergency departments were overrun with patients. We had limitations on our personal protective equipment, and frankly, hospitals did not have the capacity for patients to come there if their symptoms were mild or moderate. And so C19check.com is a tool for people at home to help them understand their own symptoms, the severity of their own symptoms, and to determine, based on their own judgment, whether or not they should seek healthcare, whether over the phone or in person. And this is based on an algorithm that was used during the H1N1 pandemic 10 years before this development, quite effectively. And at the beginning of the COVID-19 pandemic, this was built, iterated, tested amongst a research population at 2 universities, and found to be very effective at conveying information, understandable, and extremely easy to use. So it was released to the public. It was extremely popular, and we had over 1 million people use it in the first month. It was translated very quickly into about 30 different languages and used all over the world, frankly, almost 100 different countries. And especially at the beginning of the pandemic, when people didn't know what was going on, they didn't have access to their doctor, resources online were limited, people really flocked to this sort of simple to use, concise, direct healthcare advice. And so what we found, especially in the state of Georgia, was that we had very high utilization, both because of local press related to the website and word of mouth. And we were able to eventually test the impact of the information dissemination from the website and found it to be very effective. The great thing about C19check.com is that it was a simple algorithm that we've published on. It can sit on the shelf for future pandemics and be rapidly iterated upon, and it is something that the public has a strong desire for. So it was very helpful at the beginning of the pandemic, and it will continue to be helpful in the future. So thank you.